Hi, I'm Dr. James Meschino. I want to talk to you about premenstrual syndrome, or PMS. You know, premenstrual syndrome is sort of a cluster of variable symptoms and signs that affect women usually 7 to 14 days prior to the onset of menstrual flow, and then usually subside around the time that menstruation is happening. And yet some women actually have dysmenorrhea, which is sort of painful menstruation or really bad menstrual cramps. And the reality is that many of the same dietary, lifestyle, and natural medicine things that manage PMS also are helpful for dysmenorrhea or painful menstruation. So how common is the problem? Well, about 1/3 of all premenopausal women actually suffer from PMS, especially women between the age of 25 and 40 years of age. And in about 10% of cases, the problem is actually very severe. And the symptoms, of course, manifest affecting a lot of different systems of the body. So there can be emotional symptoms like depression, anxiety, gastrointestinal symptoms like abdominal bloating, as an example. It can affect reproductive tissue, breast tenderness and swelling, cramps, uterine cramps, and other physical manifestations can get worse, backache, headaches, and so on. So, women all seem to have their own individual PMS symptoms from one woman to the next. The thing is, what's at the cause of this? One of the most common findings in PMS is that there's an abnormal estrogen to progesterone ratio. So there's an elevated estrogen to progesterone ratio that occurs about 5 to 10 days prior to menstruation. And this imbalance of estrogen and progesterone upsets many internal physiological functions within the body. So the medical treatments, which are not great, include things like giving women oral contraceptives to sort of, override the whole menstrual cycle, or giving them other hormones that will sort of block ovulation. And sometimes women are given antidepressants or anti-anxiety drugs, diuretics to wash out the excess fluid and sodium, or sometimes painkillers or muscle relaxants to reduce the pain, the breast tenderness, the muscle cramps. But in most cases, the proper nutrition, lifestyle, and supplementation program can actually balance out the estrogen to progesterone ratio and significantly improve symptoms. And so I've laid it all out in an ebook that you should download from this site right now, called The Natural Management of PMS. And in there you'll see not only the whole game plan, but you'll see all the scientific references to show that you're getting sound scientific information that has actually helped other women with exactly the same problem. The trick is to put all those strategies together to get a comprehensive program. And so that very simple ebook does exactly that. So if you're a PMS sufferer, you ought to download that e-booklet right now. Thanks so much for watching.